Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome back, and thanks for joining me for this week's episode. Today, we're discussing how to create a community-based, comprehensive childbirth and postpartum model that improves women's health literacy, as well as access to integrative women's healthcare. My guest this week is physical therapist Theresa Feola. Theresa earned her physical therapy degree from the University of Pittsburgh and is a board-certified women's health specialist. She has more than 35 years of clinical practice experience with a focus on the education and treatment of women's as well as men's pelvic health. She is the owner of a private practice called the Pelvic Room, which is located in Exton, Pennsylvania. And Theresa actively lectures and presents regionally to community groups and healthcare providers on women's health topics. In fact, if you're a physical therapist, you can catch her presentation at this year's Academy of Pelvic Health Physical Therapy Fall Symposium, which is on September 17th. Make sure to check that out. On today's episode, we discuss the current state of women's health, challenges that women face to access appropriate pelvic health and pelvic physical therapy, as well as Theresa's creation and ongoing development of a community-based childbirth and postpartum model called the Perinatal Partners Network. The Perinatal Partners Network is an organization focused on providing integrated resources and care during the perinatal period. With many of the changes and challenges that are ongoing in women's healthcare in the United States as well as abroad, I think you'll find the information that Theresa shares to be impactful for the future state of women's healthcare, as well as empowering for individual women as well as community groups. Okay, without further ado, let's begin and let's meet Theresa Feola. Hey there, Theresa. Welcome. It's great to have you on the podcast this week.
Thank you for having me, Joe.
I'm excited to share with you. I know you have been a pelvic health therapist for quite some time and have a ton of experience in this area. And just as you and I have gotten to know each other professionally, there's so much that really has happened in the world of women's health, particularly, which relates to their pelvic health. So we'll probably touch on some of those things later on in the podcast. But I think a good place to start is tell me how you became interested in pelvic health. I am kind of old enough and mature enough to remember when pelvic health really didn't exist in the world of physical therapy. You and I graduate school around the same time. How did you become interested in this specialty area?
Yeah, exactly. I have been a PT for 35 years, and really the emphasis of pelvic PT has been in the last 22 years. I'm board certified women's health, and I'm also certified in pelvic rehabilitation. But I started teaching prenatal and postpartum exercise in the early 90s. And that really came about more from an orthopedic and athletic standpoint. I think a lot of us start in PT from that aspect. And so then my GYN started to mention to me, because he knew that I taught the prenatal exercise class, that in his medical journals, he was reading about incontinence, and didn't I want to do that? And I was young, I hadn't had children, and, I did not see that connection and why I would be interested. Literally, he talked to me from about 1994 till 99. And I remember saying to him, okay, I'll take a class and just see. And at that time, there were very few classes. And as you mentioned, pelvic, even muscle anatomy was never mentioned in my education. So I took a class with Hollis Herman, and in the early, or I guess around 99 or so. And as soon as I had that class, there was just a spark that hit me that said, oh my gosh, there's so much that we could be doing for women that I had never heard of. No one was talking about. I didn't know any other pelvic PTs. And it just lit that fire for me, really.
Yeah, and I always say publicly that women's health and pelvic health really has changed the profession of physical therapy in so many ways, because it really brought in a different perspective and view, really a whole person view, I think, because as soon as pelvic health therapists entered into this specialty, they realized, okay, there's a biomechanical, biomedical causes and factors we're seeing here. And then there's also the whole psychosocial aspect that's really involved in dealing with that very intimate part of our body. And we all have a pelvic floor, right?
Mm-hmm. And I think that evolution for me has really, with experience, you realize you can't, yes, they're muscles like anywhere else. And I try to convince my patients to make them, feel a little easier. Hey, this is just like if you pulled your hamstring, I'd need to touch it. We'd educate, we'd go over how you're using it. We'd strengthen it, loosen it. It's the same thing. But then again, in the same breath, it's completely different. And the intimacy factor is definitely a big part. And how we hold emotions. And the pelvis really is a container for that emotion and that automatic protection of the autonomic nervous system. And as I get into treating more and more, the holistic nature and the importance of that is really highlighted. Yeah. And I do treat men. It's very easy to say women. And, I certainly see women throughout the lifespan, and we're constantly transitioning and our needs are constantly changing, and they're very unique and often misdiagnosed, misunderstood because of history. And then I do certainly treat males as well. Obviously, it's not as frequent just because males tend to have less issues in the pelvic floor. But yeah, it's just as equally important.
Tell us, so obviously you've been doing this for a long time, practicing and specializing this for a long time. What problems do you currently see in women's health? But obviously, there are really big systemic problems. What are the problems you're really seeing kind of in your practice and in your community?
This goes way, way back, literally ancient Greece and forward. And if we can trace, I think people would really be interested and astounded by how women's medicine and women's health has evolved or changed, or actually the lack of change and understanding. And I would have people refer for awesome information is Unwell Women by Eleanor Cleghorn. And she literally takes us through the history, the politics, medicine. And you realize that we really haven't gotten very far to some of the things in history that seemed absurd and just no common sense. And we are really kind of repeating some of those things, unfortunately. So yeah, I currently see a giant call to action to make change and make it now. My biggest frustration is how slow everything is. I think in the past, we didn't have the research. Women and minorities were excluded from research until 1993. So really, that's not very long for us now to have information that we can use. So now we actually have a ton of research, and I'd like to share a couple bits with you. But the gap then in that research actually getting down to practice and getting into just the mindset in our culture of how we're treated and understood, that is really taking a very long time. So some of the aspects really, it boils down to women's health literacy, which means us having the knowledge to understand our anatomy, accessing the reliable information, making informed decisions, and advocating for our quality of care. So until we ourselves understand and don't dismiss what we're feeling and intuitively knowing that something's wrong. I know sometimes for PTs, what we're working on is big and obvious as far as our dysfunction, our pain. It's very acute. And yes, some of the pelvic and women's health issues and after birth and in pregnancy can be that, but they can also be very subtle. And there's where I like that word, like unwell sometimes, so we do have the obvious, but we also have the not so obvious. So coming from basic physical therapy, it astounds me, sometimes infuriates me that someone will be sent to me for one small knee ligament that was strained. And they are immediately sent to me. There's a plan, try PT. If you don't get better, then we'll do X, Y, Z, and we'll continue up the chain. And okay, screen them. Are they ready to get back to their sport? And we have very specific exercises we run them through. And all along, I feel like the person feels very heard and at ease because, okay, I understand the process. And none of that happens for the vast changes. Pregnancy alone. And so very often practitioners will say, oh, you have back pain. Oh, you're pregnant. You have sciatica. You're pregnant. And literally, nope, nothing we can do. And we don't do that with any other diagnosis. I never say, you're a football player, you're going to have knee pain. There you go, or you're 85 years old. Do you have knee arthritis? Well, let it be. PTs, that's our gift. Like we maximize function. We figure out a way, we modify things, we change things, so that you can function at your highest level, despite the diagnosis, right? So a couple interesting tidbits then. So first-time vaginal deliveries, 15 to 30% of women will avulse their levator ani. So that is our pelvic floor muscle. The base of our entire trunk is being torn. 25% of people will have an external anal defect. I mean, that's a pretty significant, concerning issue. 25% of us will fear childbirth. 23 to 49% will have some kind of pelvic floor muscle dysfunction. That could be urinary incontinence, fecal incontinence, pelvic organ prolapses, sexual dysfunction. Only 7% of women are aware that PT was even an option if I have a pelvic organ prolapse. The first line of treatment is surgery. Half the items on some of the questionnaires that we fill out about our quality of life with pelvic floor are over the proper reading level for people to really understand. And I know I'm guilty of this. I throw out perineum or vulvar area or whatever. And the research shows less than 50% of women could name their external genitalia in a study from 2022, vagina, anus, urethra, clitoris. The people who were able to do that were white, had already had several children, higher socioeconomic. So, it's just too little too late. The other things that occur after pregnancy, 20% of women move into a higher body mass index. I mean, we know these things, all of this is concerning when we're thinking moving forward, our health in general for our lifespan then. Mood disorders begin 4 weeks postpartum, and they increase 2 to 3 years then after that point. 34% of women will describe their birth as traumatic. That alone sits in that pelvis and halts moving forward and healing. We need to debrief. I describe to my clients after birth, I need to physically touch the pelvic floor, show it that you're good. That was in the past. That episode is over, and here we go step by step. We're going to help heal you and move you forward. Exactly as if an ankle came out of a cast, right? There's a step-by-step reassurance to the body, to the client, and a plan to logically move forward. Then we have, of course, very underrepresented in the research and the literature, Black women are 4 times more likely to die in childbirth than white women, regardless of our socioeconomic status. 96% reported a lack of education about delivery, pelvic floor. And what happens is when my expectation going in does not meet my experience, the bigger the gap, the more blindsided, the more our symptoms create an issue versus if my expectations, my knowledge, my experience are closer to matching. And the US has the highest maternal death and injury rate in all of the developed world. So if this isn't an actual, not only a call to action, I mean, this is a scream for action. I just don't understand how we can continue to let this happen. You know, I feel sometimes we have an accident that we weren't expecting and it takes us, you know, by surprise. This is something we can prehab. We prehab some surgeries, right, for clients. We know it's happening. You're pregnant. Okay, let's prepare you. Let's make the outcome the absolute best. And yes, we're not going to come out on the other end completely unchanged, 100% exactly like we were. So let's rehab. Let's make sure we maximize. Let's make sure you understand moving forward how to be the healthiest person you can. So that's a long answer to your short question.
It is a long yet very impactful answer. And as I sit here and absorb or try to absorb all that amazing knowledge and information you have, it really points to the fact that we have a women's health crisis in our country.
Exactly.
Which obviously we know as PTs, that women's health crisis has multiple branches to it. And one branch is a pelvic pain crisis. So you said something that I think was really impactful for me as a physical therapist when I think back to my career, and I would see grade 1 ankle sprains come in, right? So an ankle sprain, a grade 1 ankle sprain is whatever, you were walking and you stepped off the curb in the wrong way, or you're playing a sport and you rolled your ankle and the ligaments there were overstretched and maybe some were torn, right? Grade 1 ankle sprain probably heals within 2 weeks, right? Not a big deal to treat.
Right.
Yet we have women, the way you said is really impactful, who are going through an entire pregnancy and birthing process. The part of the body, the pelvis, has so many ligaments, so many thick, strong ligaments that do start to naturally stretch, but oftentimes are traumatically injured during pregnancy. And we just tell people, or we just tell women, I should say, oh, you just had a baby, put your feet up and relax.
That's right. There's no plan. And from a PT standpoint, it's just illogical. We don't even have long enough for me to go through all the changes that happen, like everything, the thoracic spine, the diaphragm, the activator of the pelvic floor is our diaphragm. Our organs are shoved up there, or the system is kind of offline, so to speak, for so long in pregnancy. And these things don't automatically just go back, right? We don't assume after stroke that you automatically get the function of your arm back. We help it, we encourage it, we move it along. And the other aspect of that is where at 6 weeks is the only check that we get. And at that time, we are told by our medical provider, you are fine, you are cleared to return to whatever you want to do. Now, from a musculoskeletal standpoint, that has zero bearing. If they could say from a uterus healing standpoint, you can return. But as PTs and pelvic OTs as well, we are the ones who do that screening and that clearing and say, and not only are we not helping, but I have treated numerous women who got that word and started to run or jump rope or lift heavy weights at just a few weeks postpartum and felt a pain, a drop, and now they have created a pelvic organ prolapse that yes, we can help strengthen it out, but now it is what it is. We have overstretched, we have, caused a little unnecessary damage to that person. No PT would let a woman change for 9 months, go through delivery, whether it be C-section or vaginal delivery, and just assume at 6 weeks without checking anything, glute strength, ab strength, endurance, have you been walking, and just say, go ahead, run, do whatever you want, CrossFit. It's illogical.
And the other word you use, which I know you've coined this term at this point, is women's health literacy, which you and I both looked in the literature, doesn't exist. So we're putting this on record right now that Theresa Feola coined the term women's health literacy, and the impact and the sequela of what that means to women's health, both in across the lifespan of women's health. But you brought into the conversation, obviously, the important aspect of social determinants of health, and groups that are marginalized who don't have any kind of information about their own human body.
Mm-hmm. Exactly. We do have, some of my colleagues are working in rural PT areas and trying to come up with good solutions to this. Pelvic PTs, OTs are hard to find even in urban areas. So what is the solution? So now, luckily, we're starting to have some telemedicine, some online. Obviously, it's hard to do with pelvic. I mean, with any rehab, but especially pelvic, but they are being creative. They are getting it done. Something is better than nothing. Luckily, too, thanks to the pregnancy and fourth trimester task force for the Academy of Pelvic Health of the APTA, we have a bill that is introduced to the House of Representatives to make some Polish C change finally. But really, I feel like it's grassroots, in the community. Maybe it's just me and my personal preference. Like, I'm a little frustrated. Like, I can't wait for policy change. And so I think that's what happened. I was frustrated with how women were being treated, in the traditional medical model and via insurance. And so in 2020, I branched out and opened my own practice so that I could at least feel like the only part I can control of this entire enormous, frustrating system is my little area. And if I can just make sure that the women I can come in contact are getting treated the way I feel that they should be treated, let's start there. Yeah.
And there's something else you said too, and I want to make sure we touch on this before we move forward to the next question. Pregnancy can be traumatic. Some women bounce back from it, but you mentioned that a large percent of women view their pregnancy as a trauma. Now, the word trauma, PTSD, right? Post-traumatic stress disorder. A lot of people think of that as a psychological problem or challenge, and there are definitely psychological and emotional components to it. However, you said something very succinct, and I can't remember how you said it. I'm going to paraphrase you, and forgive me if I didn't remember exactly the way you said it. But since the trauma is in your pelvic floor, that's where the trauma is stored, in that part of your body. And we know that to effectively heal trauma 100%, because trauma is an embodied experience, we have to work with the body.
Exactly.
And I think to myself, how many women have been traumatized by pregnancy? And even if they found their way into counseling, they've never found their way to the physical side of it. We know that you have to work with the body to effectively treat trauma.
Exactly. That's how I explain it to my clients. Vast majority of them have not even had the psychological treatment, but some have. Of course, a large percentage of what I see too, I mean, the number of people who have dealt with abuse or adverse childhood experiences, even leading into this. And we know that somebody who has been sexually abused in the past has an increased incident of C-section, because of all the muscles in the body, the pelvic floor muscles are the first and foremost to react to a sense of alarm. And since they have been traumatized, they are going to react. And there are so many triggers you can imagine: fear, pain, medical community. And so often this is not even on the radar and talked about as we are heading in. And that is a disservice. It's hard enough if we have not been abused. If we have been abused, that person needs prehab and physical touch and in the body awareness of how can I best relax, open that floor when all it wants to do is close and tighten and protect me, in order to have a faster, less interventions delivery for that person.
Right. Because if someone has polytrauma in their history, the pelvic floor is responding, and even something as simple as light touch to that area can cause a trauma response and reaction.
Yes. Yeah. We see it. The pelvic floor starts to respond, and the pudendal nerves down around anus, vaginal, clitoral area, they start to become super sensitized and actually grow by even like the third yeast infection or the second, third UTI. It kind of makes sense, right? When we say first infection, the body goes, oh, geez, sorry, I didn't protect you. I'll be more alert this time. Second one, wow, you got another one? Okay, I will really protect you and put the walls up. And it doesn't take much. One painful sexual encounter, that guarding starts. I treat puberty, inability to insert a tampon. Anxiety leads to pelvic floor tension. So just our adolescents that are going through so much and are so anxious. And there is where that learning should begin, right? Oh, these are your muscles. They're protecting you, and just make it light and educational. Like, gosh, I find it amazing that we can have parts of our body that we don't even understand and know, right? Guys don't have that. Would never say that, right? So yeah, we're doing a big disservice.
So you've started to take all this energy and information you have, and you've started to channel it into a couple different places, because you're addressing, rather than, obviously just being on this podcast is addressing some of this challenge, but you've really gone a step further to address the gap that you're seeing in women's health. Can you tell us about that?
Sure. Yeah. Time and time again, I just saw women walking in saying, wow, I didn't know this was a thing. And it's funny, among us, that is what we hear. It's not a thing. I didn't know it was a thing, this whole pelvic, taking care of the pelvic, PTOT, whatever. Among other PTs, they don't understand the scope of our practice. I think if anything, maybe they say, oh, you work with pregnant women, you work with incontinence. I mean, that's just a small segment. And if we think about, everybody uses the word core. I'm doing core. I'm doing core. Nobody really knows if you say, well, what is core? I mean, this is what we're talking about: the diaphragm, the breath, how the breath is relating to my anxiety, to my autonomic nervous system is a key factor to how the pelvic floor moves, the low, deep transverse abdominal muscles, and the little multifidi. That's true core, but yet we're throwing that term around. So even if, we're working with our athletes, you are working with pelvic and with core. And so if I am a sports medicine PT and orthopedic PT, it would be important to know what kind of history someone has had in this area. And I don't think we really ask that, even C-section, do we have that adherence to that scar maybe? And I have seen that be an impact after years, and it continues to bind for back pain, SI joint pain, knee pain. I mean, and we're missing a big part of that subjective, information. I'm not sure if I answered the question.
You did. How have you started to address this on a larger scale?
That's it. So, the frustration was just building, seeing women coming in. I met with a chiropractor, Shannon Behrens of McCormick Chiropractic, and she and I both have similar frustrations. And we decided, hey, we each know practitioners in our community here. Let's meet and have coffee and just all talk. And so we were meeting with doulas and midwives and massage therapists and personal trainers and anybody that we knew that sort of had the same frustration and passion. So as of April of 2022, much grateful, I stumbled across your innovator program. I had some ideas running through my head and didn't know what I was going to do. And thank goodness you helped to reel me in. And so what has stemmed from that is Perinatal Partners Network. So there is a website, perinatalpartnersnetwork.com. And what this is a directory for women. So we tried to kind of keep it grassroots, community, that whole idea of, once again, it takes a village. And I was seeing that women felt good if I knew your chiropractor, your massage therapist, and we all come on, we have you, we understand you. So we started a website directory. At this point now, there are 15 different specialties represented between yoga, midwives, chiropractors, doulas, psychological counseling, complementary medicine, conventional medicine is the area I'm trying to link and have more practitioners on. That's a big goal for us for the future. Lactation consultants, speech and feeding. Believe I'm forgetting some, but at this point, there are 64 different practitioners in 3 different counties in our immediate area. And the goal is so that women can get treatment faster, easier. They feel supported. They don't have questions. They understand. And under each of those specialties, that's the person who knows the latest research, who has here's a great book, here's a good website, check out this Instagram person. They're following that specific field. It amazes me when sometimes medical practitioners will say, you don't need pelvic PTOT. Well, what do you know? I think I'm the one to tell you if you need pelvic PT or OT. So that's what we've done for all the specialties. And if someone calls, so the whole idea is resolution of an issue. You go to a medical provider and you say, you know what? I'm 3 months postpartum and I'm still having painful intercourse. And it usually just ends there. If you mention that, so there's no resolution. So the hope is if you enter our network at any space, we all understand what each other does, and we will point you in the right direction. And we are not going to stop until there is resolution for all of your complaints, big, small, and that is going to help the infant and the child and the family and the community, and hopefully make change in this world. So that's the story. So it's helping women, our directory, it's helping practitioners. I have learned so much. Been a PT for a long time and didn't know the scope of, maybe chiropractors. PT chiropractic, I know, has a long history of maybe not inner working. I really feel at this point in my career, I am tired with us all working in our silos. And I have noticed, at least in my field and for women, we do better when we have multiple viewpoints. And as a woman, I might choose one path and somebody else chooses another based on my ethnicity, my goals, my background, my history, my ethos, what I believe. No one should be able to tell me what my path is. I will figure it out after you have given me all the information, laid out my choices, and then I can make the choice. So there's benefit to the practitioners. I have seen the look on women's faces when I hand them the paper that says, here's a QR code. It lists to a directory of 64 other people right here in your town who are dying to help you. So it relieves me. When I feel a woman is depressed, I don't have to try to figure out, well, where should I send you? What should I do? I hand them that website and say, here's a whole bunch of practitioners that I personally know. Part of our criteria is that either Shannon or myself meet and greet the practitioners coming on, same ethos, non-competitive, passion for women. And so we will make sure that we meet, but it just seems to be a win-win all the way around.
So the website is perinatalpartnersnetwork.com. Everyone can put that into their web browser and check it out. So obviously the aim of the Perinatal Partners Network is to create an interdisciplinary pelvic or women's health community platform, right? This is a website, but that website represents your geographic area where you live. I guess you tell people where you live, right?
Yeah. So I'm outside Philly to the west of Philly, about 45 minutes, Exton, PA. So we have 3 counties right now. Our goal is that then people are going to start replicating the model near us if we need to talk to each different group, and it spreads. My personal goal is that then this will also spread and we will have a network and directory for adolescents and also for the peri and menopausal time period, because the same misinformation, misunderstanding, and, unnecessary suffering is going on in those areas too. Yeah.
Right. So obviously this is a resource for women. So as you mentioned, also a resource for clinicians because you're learning from each other, but it's a resource for women where they can access care. There's an education component. So it targets that women's health literacy that you mentioned before. And then it optimizes their either prehab or rehab process because you and your partner can streamline the onboarding process for them and connect them with the right people.
Exactly.
Yeah.
Exactly. Yeah.
It's quite simple, elegant, and brilliant, isn't it?
I think.
Because there's currently nothing else out like that out there, really.
I don't think and this whole idea of collaboration, I think we just need more, I don't know, kindness, caring, unity, community, like whatever. All of this is really small and large at the same time, I think, when we look at the issues that we are all facing today. So we can look at it in a very narrow view, or you can expand upon this and really enlarge it. Yeah.
Yeah. I mean, Theresa, you've been doing this for a long time now. You've seen lots of different facets of the women's health world, and, you've seen things grow, and, we have things now like policies that are coming in that are impacting or have the potential to negatively impact women's health. Where would you like to see, or how would you like to see this initiative grow, let's say within the next 5 years? I know you're a big picture person, so I know you have kind of big hopes and dreams and visions. So I'd love to hear what those are.
I would love for it to almost mimic what we do with sports medicine and how we treat our athletes. My goodness, let's prep before we get pregnant. Let's help all through the process. Let's immediately have a plan and screen to get back to our activities of daily life, our recreation, our occupation. If I'm having any little issue, we get you back in the system, we figure it all out, because this is broader than just the physical, right? I have seen when we are disconnected from our pelvis, from our core, that has ramifications to confidence, anxiety levels, right? This is a very grounding. So it's very holistic, broad-based. And so just empowering for women, bringing the feminine importance. I think sometimes we also are perpetuating this because we have worked so hard to be seen as equal and strong, and we can do it, that a little bit is, I just had a baby. I can get back to work. I can have a family. I can do this and that. I can get my body back. And the pressure. And yes, believe me, I am one of those women, and I want to see that happen too. But there is a logical, efficient way to go about that. Yeah.
So again, we'll point everyone to that website. It's perinatalpartnersnetwork.com. You can all check that out now and take a look at it. But you also have another website where people can connect and learn more about you, Theresa, as well. Can you share that?
Yeah, my business is pelvicroom.com, and I'm outside Philadelphia. I am a soul practitioner there. I tried to make it a personalized, holistic. I work out of a collaborative wellness facility. So I tried to make it a new area, a safe area for people. Yeah.
Great. So make sure you check out that website as well. It's pelvicroom.com. Theresa, it's been great speaking with you today. Thank you so much for all the work that you're doing and really being a leader and an innovator in pelvic health and physical therapy and women's health in general. Again, all those links that we mentioned today, pelvicroom.com and perinatalpartnersnetwork.com, you can find those on the show, the web form at the Integrative Pain Science Institute.com. I'm Dr. Joe Tatta. It's been great speaking with you this week. Make sure to share this information with your friends and family on Facebook, LinkedIn, Twitter, or Instagram. You can tag me as well as Theresa on Instagram. We'd love that. I'm on Instagram at drjoetatta.com and Theresa's at Pelvic Room. If you tag both of us, we'd love that. And we'd love to hear your feedback about this week's episode. Thanks for joining us, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.